All right, I'm sure you guys have heard the CEO of United Health Care, the largest insurance company in America and perhaps the world. He was murdered a couple days ago. Looked like it was premeditated. Looks like it was planned. Who the perpetrator was is unknown at this point. Although it looks like they may have identified him and will eventually apprehend the guy. Chances are it is a disgruntled beneficiary, perhaps, or a family member of that. As he is, inscribed, deny, depose, and delay, or something like on the bullet casings he utilized, indicating that there is something wrong with the practice at United Healthcare. United Healthcare, again, the largest insurance company in the world, one of the biggest companies in the world as well. I think they're the 9th largest company in the world. I think last year they took in something like 900 billion or something, some ridiculous number. And the CEO was killed in cold blood. It appeared that he tracked him down, knew where he was going to be. There's some concern as was this an organized hit, that someone knew exactly where he was from the inside. I mean, there's a lot of shady stuff going on around this, and obviously tragic when someone is murdered. He has a family, he has children. It's tragic for them. I mean, no one clearly, and this is not anything new, no one is advocating for that type of behavior, that vigilante justice. It is indicative of the frustration, perhaps, that people feel around these healthcare companies. And I will give you, the easy thing to say was, yeah, the companies are screwing people over, people are getting pissed, and the guy got killed. There's some of that for sure. But I think when we look at the fact that here in the United States, we pay more money than anyone else, we have some of the our healthcare outcomes are at best poor. We spend more money, life expectancy is down, we have a lot of sick people. And in part, one of the reasons why our healthcare is so expensive is because we have a very, very sick populace. I mean, that's part of it. And, I get the fact, United Healthcare denied more claims than any other health insurance company, on earth, basically. I think something like around a third of their claims go fully denied, which is well above the industry average, which sits at around 15%, if I'm not mistaken. Now, one thing I will say is that, does it make sense for healthcare companies or health insurance companies to deny claims? And in my view, it probably does in many regards. I think we overpay for healthcare. I think a lot of the healthcare, what we do provide, is indeed unnecessary. And it's not in the sense that, people don't need these treatments given the nature of the system. The system itself is broken. And because we emphasize Band-Aids, because we emphasize after the fact care rather than prevention and actually treating root cause things, which ultimately are much cheaper, ultimately are going to lower healthcare costs, ultimately are going to lead to far less sick people in this country. That's where we need to go. And so the lesson here is not, insurance companies stop denying people's claims because they're going to get angry. The lesson should be, we need to reform the system so that healthcare is no longer so expensive, because we do not have such a sick populace. We can debate, politically how to pay for all this stuff. How do we pay for Medicare? How do we pay for Medicaid? How do we, do we have a nationalized health insurance where everyone has, quote unquote, free health care, of course, paid for by taxpayer dollars? Or do we actually address the problem and go after the causes of disease, not after the fact, reactive stuff, proactive, prevention, root cause medicine, which again is, in my view, the only viable solution that can work. We're not going to technology. We're not going to drug our way out of this epidemic. And quite honestly, we can't afford to, even if we could. So with that in mind, that's what I'm trying to do. That's one of the things our company Rivero is doing. We are trying to, at an affordable price, bring down the cost of healthcare, make it more equitable for more and more people, make it so we don't have so many dang sick people. The solution to healthcare is not more drugs, more spending, more access. The solution is less sick people. All right, let me know what you guys think.